Namaste, Swagatam, Vanakkam, Namaskaram to everyone. Welcome to the fourth session of our Satsangha 999. And with the number 4, we have to always be a bit alert. And Zoom wasn't logging in for the last 5 minutes for some reason. So pay attention to detail is the message of the 4. So we'll do our best for that and keep our fingers crossed. Let us begin with the invocation to the Guru Parampara. Om Tad Paramparayaya Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guru Prachodayate Om Om Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj Ki Jai. Today, we are looking at the very interesting topic, which is yoga therapy. This is often also referred to as yogic therapy. And another way it is used is yoga as a therapy. So yoga therapy, yoga as a therapy, yogic therapy, but more correctly, this should be referred to as yoga chikitsa. Yoga chikitsa is the traditional term. The term is yoga chikitsa, and this is the classical term. Chikitsa is the classical term that we use for therapy. So the concept of yoga chikitsa implies the application of yoga as a therapy. So here I have already given you a few different angles through which we can look at this. Yoga therapy, yogic therapy, yoga as a therapy, and the therapeutic application of yoga. Sometimes people use it in a shorter form, therapeutic yoga. So I'm giving you all the different perspectives that come to mind when we think of this concept of yoga therapy. But the term yoga chikitsa is more wholesome. And one of the things we have to be careful when we set out in the application of yoga in any human endeavor is to make sure it is wholesome and not piecemeal. In the modern world, yoga has been taken and is applied rightly or wrongly in different fields of human endeavor, but often in a piecemeal method, piecemeal approach. Piecemeal approach of yoga is the antithesis of yoga. Because yoga is all about wholesomeness. You are becoming the whole again, W-H-O-L-E, moving out of the H-O-L-E that you have dug for yourself, thinking that you are the frog in the well in the hole. A well is nothing but a hole in the ground filled with water. You have your own self-endangered hole in the ground and you are drowning in it and saying, who can I blame for it? The typical featherless biped that inhabits this planet. From that, you want to move into a wholesomeness. You want to become the whole once again. And our Vedic literature, never forget that yoga has a lot to do with Vedic literature. And at times we even say yoga is pre-Vedic, because Hiranyagarbha, as we have seen earlier in the first session, the golden bioplasm, the germ plasm of life, when life began and that one became two, immediately yoga had to manifest to enable the two to become one once again. So yoga was not required as long as there was oneness. But the moment the one became two, yoga was required to help the two become one again. Swamiji used to say the first disease is us thinking we are separate than the universe in which we live. The first disease is to feel that you are separate than the universe in which you live, because we have forgotten that we are the universe. The drop has come out of the ocean and it says, here is my selfie of me, the big drop. It has to be reminded, you are the ocean and the drop is a temporary phenomena. Swamiji's concept is very beautiful, because when the mind thinks that it is different than the universe in which it lives, you have forgotten your own identity. You have forgotten who you are. In that moment, when you forget who you are, you become something you are not. And that separation between what you are and what you have become is a split. And that split is where disease has started. Because dis-ease implies a movement away from a state of ease. A state of ease is sukha. Sukham, sukha. We do the sukha pranayama, where you breathe in and breathe out for an equal count. And you feel at ease with yourself so much, your blood pressure starts to come to normal. All your stress starts to come down. You start to be able to sleep better. Why were you not sleeping better? Because of your stress. Why did you have stress? Because you were caught between what you are and what you think you are. This is not just philosophical. This is what we are struggling with. Because we have identified with a name, a nationality, a religion, a job, position, a family relationship, and that identification with something that is impermanent has moved us away from our permanent state of ease, that sukha sthanam that Ammaji talks about. Sukha sthanam. Sukha sthanam, and I'll just type it out. S-U-K-H-A-S-T sthanam. Sukha sthanam is a place, a point, your own niche of ease. It is a place where you are at ease with yourself. Sukha sthanam. And if you are in sukha sthanam, there is no dukkha. Because dukkha implies disease and suffering, which is arising because you have moved out of your point of ease. So there's a point of ease. It's like you're on a seesaw and there's a middle point. That midpoint on the seesaw is where balance is there. Balance does not lie on the right extreme or the left extreme. Balance lies in the middle, the golden mean. The golden mean is where balance lies. That point where samatvam manifests, equanimity, equilibrium, equipoise, all of that manifests at that midpoint. And I'm sure Padma will come up with a visual imagery of this because she is putting together some amazing visuals. And she's been sharing a few of them on Facebook. Many of them you don't know. I see them because I get private access to her creations on Canva and other places. Balance is the golden mean. This is the same message that yoga gives, the same message that Gautama Buddha has given. The golden mean. Because when you are on that golden mean, you are balanced. Imagine, I remember there was an image of a person crossing the Niagara Falls. You know those Niagara Falls up there in North America? You know, this person was crossing it on a tightrope. And when they walk on a tightrope, they normally have a long piece of wood, you know, to sort of help them balance. Getting from this end to that end on that tightrope across the Niagara Falls, you really know what the golden mean is all about. Because if you lose your balance for one moment, you are down in the water. You know, would you believe me if I say life is about 1,000 times the challenge of crossing the Niagara Falls on a tightrope? That is the challenge we are facing. Every moment, something is pulling you off balance. Every moment, something is pulling you out of your state of ease. Your sukhasthanam is being lost every moment by challenges, both from within and from without. The internal challenges and the external challenges. And believe me, when I say it, the internal challenges are the tougher ones. The external challenges are minuscule. They are kindergarten challenges compared to the postdoctorate level of challenges that you get from the inside. And all of these challenges, what are they trying to do? You are trying to walk across the Niagara Falls on that tightrope, balancing on the golden mean of samatvam, and they are determined to throw you off balance. Maharishi Patanjali tells us these are the kleshas, these are the antarayas, these are the chitta vrittis. All of these come together. The chitta vrittis, the antarayas, and the kleshas, these three especially, come together to pull you out of your point of ease. You have just got there and you are like in that beautiful sthira and sukham. You are stabilized in your sense of wholesome ease. And then the mosquito bites you on your nose. It's just absolutely amazing how this happens. Just when you think, I am so balanced, the internal mosquitoes and flies start running around. Just that moment where you say, finally, I made it. You have that cyclone go. Now, you know, every human being, well, it's there in every living being, but in human beings, we are a bit worse off. See, other beings are not so worried about all of this. See, other beings are more worried about, can I get some food? Can I get a place to sleep? Will I find a place where I won't be harmed by an enemy? Will I get a mate? They are limited with that. Now, the moment you start to have higher aspirations that are potentiated by the prefrontal cortex coming alive in us human beings, suddenly the challenges become even worse. Because there is nothing which is more disturbing. There is nothing more disturbing than a mind out of control. And that is why yoga is not about the body at all. Patanjali is so clear. When we have the Vyasa Bhashya on the Yoga Sutra, and they introduce through the Vyasa Bhashya and then Bhoga's commentary, you find Yogena Chittasya Padena Vacham. The shloka to Patanjali starts off Yogena Chittasya. Yoga for the mind, grammar for the speech, medicine for the body. And Maharishi Patanjali, that great saint who has given us all of this, we salute you. Yoga for the mind. Because in the internal obstacles, if you look at these 9 obstacles and the 3 symptomatic attendants who come along with them, making it that lucky number 13, 9 plus 4, 13, the lucky 13, all of them are based on an internal loss of balance. Now in modern times, what do? Well, unless you are really deep into yoga and you have been working on yourself with a lot of yogic selfies called Swadhyaya, if you have not been doing that, most probably you will be making a list of all the people to be blamed for everything that is wrong with you. This is the common tendency. Make a list of all the people you can blame for what is wrong with you. Now, the moment you really get on the yoga path, it changes. Make a list of all the things you need to work on within yourself, which are preventing you from knowing your own point of inner ease, sukhasthanam. The journey is totally an internal journey. And that is why it is so difficult to measure, because it is a journey of each individual on their own path. Incomparable to anybody else. We can learn from others, from their journeys, their trials and tribulations, and their successes. The peaks and valleys of each person's life can be a good lesson, but the journey is ultimately each individual's. So Swamiji's concept of yoga therapy, yoga chikitsa, is that we have lost that oneness which enables us to be wholesome, that enables us to be at ease with ourselves. We have moved away into two-ness, duality, dvaitam, where we feel separated from the universe in which we live, and hence that viyoga, that separation, is where the root cause of disease arises. And it doesn't matter what the disease is diagnosed by a modern medical practitioner and what they call it. Whether they call it bipolar affective disorder, whether they call it diabetes mellitus, or any of these fancy names that we have in medicine. It doesn't matter what they call it. The ultimate root cause is a sense of disunity, viyoga. What is this disunity that is happening? It is always useful to use the Panchakosha model. And often I find people saying, oh, that is not yogic, it is Vedantic. And again, I keep on telling people, why are you looking at things in boxes? Indian culture never looked at things in boxes, that, oh, that is Sankhya, this is yoga, that is Vaisheshika, this is Buddhism, that is Jainism, that is Tamil, that is Sanskrit, that is Hindi. Indian culture never looked at it that way. we looked at unity in diversity. The whole Indian approach, Indian cultural Sanatana approach was look at the unity in diversity, find the commonality in the message and enhance that commonality, because that is where the strength lies. And this is why for Swamiji, the concept of Advaita, Vedanta, and his perspective of yoga as given by his teacher was very, very strongly onto the principle of oneness, moving from the lack of oneness to a regained sense of oneness. From the lack of oneness to a wholesome sense of oneness. I think that's a nice way to paraphrase that. Because in oneness, there's no disease. When this comes into the Pancha Kosha, how we can understand it is we have the Annamaya, the physical existence, the anatomical existence, as I like to call it, the structural, anatomical, physical existence. We also have the physiological, functional existence, the Pranamaya. We have the psychological existence, which is the Manomaya, the discerning intellectual existence, which is the Vijnanamaya with the power of choice, and Anandamaya, where we have a sense of oneness with everything that exists. The Anandamaya is where you realize the oneness. And if you think of this as a membrane of a bubble, think of a bubble, you blow these bubbles, you have that outer beautiful colored, rainbow colored membrane that comes. Kalavati is there today with us, and Kalavati, whenever she used to come and the kids were small, she would bring these bubble blowers, and the kids would enjoy blowing bubbles. I think I enjoyed it more than my kids, but anyway, blame it on the kids. You want to do it as an adult, and so you blame it on your kids and you do it. Kalavati used to bring tents, and seriously, how she ever managed her luggage, God alone knows, with all the stuff she used to bring for the kids. We had swimming pools and tents, and oh my God. So seriously, that's why I call her Superwoman Kalavati. She is. When you blow that bubble, you have this outer membrane. That outer membrane is like your Anandamaya Kosha. And that outer membrane is constantly communicating with the rest of the non-bubble. Okay. There is the bubble and the non-bubble. And the bubble, when it breaks, it goes back to the non-bubble state. Okay. I'm playing with the words today. I love this. Okay. You have the bubble state and you have the non-bubble state. And the bubble has been blown and, hey, ma, look at me. I'm this beautiful bubble. And then, and there's no bubble and you've gone back to your original state. The no bubble state. Okay. Now, when you're in that bubble state, that bubble is in communication with the rest of the non-bubble through that outermost membrane. And for me, the Anandamaya Kosha is like that. It is your outermost membrane or innermost membrane, depending on different traditions. It is that part of you that is communicating with the rest of the universe constantly, every moment. There's a back and forth communication going on. Now, most people are so far away from the Anandamaya Kosha, they are so stuck in the Annamaya Kosha that they are not able to communicate with the rest of the universe. And this is where people get stuck with such big, fat, bloated, dense egos, thinking that they are the only one. And what has happened is they've got so stuck with the lower three koshas, especially Annamaya, Pranamaya, Manomaya, that the Vijnanamaya, the discernment itself has not awakened, let alone the connectivity and the awareness of that connectivity. See, the connectivity has always existed, but we lack the awareness of that connectivity. And so what happens is, there is a split. And this is why when we were talking about the concept of Nara the other day, Nara doesn't manifest in the higher two, the last two koshas. It's primarily in the lower, Annamaya, Pranamaya, Manomaya, because these are more individualized. Me, my body is working and I'm thinking. It's all this identification with this lower part. And the higher part where wisdom dawns and you say, it's ultimately not me, it's we. When you start to move from that me to we, as they say, when you move from I to we, illness becomes wellness. That is that movement. Because people are so stuck in me. And no, Zoom didn't get stuck. It's me going on and on, drilling it into you. Me. And people get so stuck with their nose down in the mud, they forget that the sky and the rest of the universe exists. This is the disconnect. This is the disconnect that has to be set right if yoga as a therapy, yoga chikitsa, is to truly be yoga chikitsa. Are you enabling the person to connect to the bigger picture? Because if they don't connect to their own perspective of the bigger picture, they will never have a sense of ease. And if they don't have a sense of ease, all you are doing is a temporary fix. You are fixing the leak in the dam with tissue paper. And in Corona times, tissue paper is a good analogy for what people thought will fix Corona. Fixing the dam, a bursting dam with tissue paper. And you say, yeah, I fixed it. I gave you Shavasana for your hypertension. What you have done is, okay, we will give it a name. We call it Yogopathy. My favorite term over the last decade. Well, I think the other one which has become my favorite over the last half a decade is salitogenesis. Because salitogenesis is the heart of yoga therapy to me. Not focusing on disease, but focusing on health. So coming back, what we want in yoga therapy, yoga as a therapy, yoga chikitsa, is to help that individual who has this underlying split to unsplit and regain the sense of ease, moving from dis-ease to a sense of ease. So when you want to do that, it means that you need to work at all levels. That whatever yoga technique you give, and it doesn't matter which tradition, it doesn't matter what type of technique, irrespective of the technique, the tradition that is used, what is most important is the principle being applied. People always want to know what is the technique for this disease and the technique for that disease. I said, you need to know what is the principle to be applied, not the technique. Because easily you can take one technique and apply it to everyone if you want. Because if you get the principle, you'll realize that. The whole underlying principle is a restoration of a connectivity to the self. Putting the pieces back together. Letting the pieces of the jigsaw puzzle come together where suddenly the person will understand the bigger picture. And yes, Sunny, CBT is based on this whole thing, which is Pratipaksha Bhavanam. Maharishi's Patanjali's Pratipaksha Bhavanam, adopting the contrary attitude. How do you adopt the contrary attitude? Look at the bigger picture. The moment you look at the bigger picture, the picture you had pales. The tsunami becomes a wave because your expansive perspective has changed the whole perspective. Can we expand the person's perspective? How do you do it? You work with the body. How do you work with the body? Mindfully. How do you work with the body mindfully? Breathfully. So the body has to be worked mindfully, in tune with the breathing. And that is why the prana, remember what is prana? It is the catalyst that holds everything together. Lack of prana, everything falls to pieces. So from that perspective, any disease can be understood as an imbalance of prana. It is one way to understand disease, as an imbalance of prana. And if you look at the 12 types of prana, the 5 major flows, the 5 minor reflexive flows, and the 2 higher neuro, mental and psychoneural type of flow, psychomental and neuromental flows, you will start to see how the imbalance of these flows has resulted in what has manifested as a vyadhi, as a disease. When you move the body mindfully, and when you move the body mindfully, it will be slowly. If you see somebody jumping up and down in a yoga class, most probably there's not much mindfulness there. When you are mindful, you will become slow. When people are mindful in their communication, they will speak slowly and steadily. If somebody gets up on stage and goes, yoga as a therapy is found to be, and it comes from the and then it goes down and this, it comes out, that, it means there's no mindfulness there. They have memorized the script and are having a bout of verbal diarrhea, nothing else. Because when you are mindful, there will be space between your thoughts. The space between your thoughts and the space between your breath. This is a key element in yoga as a therapy. You need to increase the space between the breath, and you need to increase the space between the thoughts. And suddenly, the whole process slows down, and suddenly you see what you need to do. There was a funny episode I read about some time back, where a heart surgeon, a guy who goes in and does surgery, open heart surgery, he was at his car mechanic's workshop. And the car mechanic, as he's repairing this guy's car, he says, doc, we both basically do the same thing. We go in and, change the wires around, and, we clean things up and unplug things and get the circulation going. And the car mechanic says, why is it that everybody thinks you are doing such a great job compared to me? And the heart surgeon said, try working on that motor while it's running. Try working on that car motor, that engine, while it's running. Because that is what the heart surgeon has to do. They have to do it while it's still running. I think it's a very, very important thing to keep in mind. Doing dissection on a dead body is very different than doing surgery in a living being. And as a yoga therapist, one needs to remind ourselves constantly that we are working with a living, feeling, thinking, spiritual being, not just the body. And this is where slow movements done with mindfulness and done with the breathing. Every movement that you do, if you are breathing and moving into that movement, breathing out and moving out of that moment, you have now brought three of the koshas together. Your Annamaya, Pranamaya and Manomaya have suddenly got glued together. The prana, the pranic glue. And that's a nice one, Padma. Keep it in mind. The pranic glue is holding the pieces together again. And you are not doing some mindless activity. You are using your viveka. You are developing your discernment. Hence, the Vijnanamaya Kosha is also starting to come into it, because you are now moving on an introspective, self-reflected journey. Now, if you are doing it just because your teacher or therapist is guiding you and you're following their commands, the Vijnanamaya Kosha is not getting awakened. But if you are starting to self-reflect, what is happening in me as I stretch, what is happening in my body, what is happening in my mind, what is happening in my emotions, what type of experience am I having? When you are turning your CCTV inwards, your Vijnanamaya Kosha has come, and that is also now coming back together. So Annamaya Kosha, Pranamaya, Manomaya, and then because you are self-reflecting, and this is why when yoga is applied as a therapy, we must foster self-reflection in the client, in the participant, in the patient. Not just, I am the therapist, I will tell you what to do, do it. No, that's nonsense. That's not helping anybody except your big, fat, bloated, dense ego. Nothing else. When you ask the person, what do you feel when you do it? What is your experience? I think it was Kalavati some time back was mentioning that she often used to do the practices with people, not tell them what to expect and then ask them what they had felt. I think this is a nice approach to keep in mind, both in teaching and in therapy. It is then the person is thinking about it. Otherwise, people think a yoga session is just where somebody guides you and you just follow them blindly, the blind leading the blind and falling in the well together. That's not what we want. We want to empower, and this is an issue I've had with IAYT on that word empower, now sort of getting out of the definition, and there are pros and cons, but I'm still up on that. The individual has to take charge of their healing. You are not healing anybody. Again, a big issue in yoga therapy is when people run around calling themselves healers. I tell you, when you run around calling yourself a healer, that is an egotistical journey. You are assisting the other person to heal themselves. You are facilitating the healing in the other individual. You are healing no one except maybe yourself. Your scope of practice is you. That is what yoga teaches us. Your scope of practice is you, not somebody else. And this is why when we talk about yoga chikitsa, there has to be a giving over to the individual an opportunity to contemplate their own experience of recovery and self-healing. Now, sometimes people are not ready for it. So this may not happen right away. You may not be able to do it in the first session, but after a few sessions, as the person gets to know you and you know them, maybe then this type of introspective, self-reflective journey can begin. It may not be possible in first, because people may be scared. When a person is scared, they don't want to self-reflect. And sometimes it may be better not to let them self-reflect at that point. I was recently telling someone that there are actual medical research papers telling us that meditation may be contraindicated in depression and a few other conditions. And I was asking them, have a look at that. Have a look at that. Don't just dismiss it. Think about it. Because if the person already has a lot of negativities and you are putting them on an introspective journey without giving them the tools to deal with the negativity first, you may actually strengthen the negativity in the individual and worsen their condition. This is why there has to be a lot of both head and heart in yoga therapy. Head and heart both in equal dosage. Have compassion and also have the ability to know how to guide the other person and support them. My professor of surgery used to say, you should be like a midwife. You are not delivering it for the mother. You are helping her deliver the baby. And the best midwife is the one who does the least. But we always want to do the most. And so pull the baby out or push it back. People get, it's the same thing here. Can you give that space for the individual to heal and be the safety net? You as a therapist should be a safety net for the care seeker. Very difficult to develop this. A person has to have a very, very strong capacity of self-reflection to be a good yoga therapist. It's not just about technique. It's not just about technique. Capacity for self-reflection and the capacity to give the other person space. Not always be saying, do this, do this, do this, do this, do this. No, that's nagging. That's not yoga chikitsa. When we come to yoga chikitsa, a four-pronged approach is very useful. And this approach is traditionally based on the Yoga Sutras. And in our Indian culture down here in South India, the Tamil scripture called Tirukkural, the same concept is found. And the concept normally given is Heya, Hetu, Hana, and Upaya. Heya, Hetu, Hana, and Upaya. And I've just typed it up there so that you can have it on your screen. Heya, Hetu, Hana, Upaya. Now, Heya refers to the challenges the individual is encountering. And I'm using the challenges, I'm not saying symptoms, I'm using the word challenge here because when you say challenge, you have a much bigger perspective. When you say symptom, people think headache, fever, tummy ache, they think like that. But when you say challenge, you can start to bring a lot of things that come up in life also for the person, which may need to be addressed, that they may have been in denial. Heya refers to the challenges the individual is facing, could be physical, mental, emotional, financial. Big issue these days. I remember when one of my friends who did not speak Tamil, he picked up a few words and was speaking to one of the patients in the hospital and he said, Yenna kashtam. Yenna kashtam means what is your problem? And the patient referred pana kashtam, which means money problem. He wanted the patient to say, I have body ache or fever. And when he said, Yenna kashtam, what is your problem? The patient said, money problem. Now, as a doctor, how do you set that right? But it was a beautiful answer because that may have been the primary reason for the rest of the stuff. And that is why when we talk about physical, mental, emotional, social, spiritual health, never forget financial health. Because financial health may be a major contributor to the rest of the lack of health the person is experiencing. Now, I'm not suggesting you give people money, but maybe you can get them strong enough, build back their self-esteem enough to go and get a job that they deserve and that they are worthy of. That may have been something they were not trying because they didn't have the enough confidence in themselves. Maybe you can give them back their confidence to go out and be the best version of themselves they can be, and then set right that financial imbalance also. Hey, yeah. Huh? Hey, yeah. Yeah. Hey, yeah. Hey, tu. Hetu is what is the cause. Now here you have to be Sherlock Holmes personified. Because the person has all these challenges, you now need to find what is the cause behind all of this. And this is where being a yoga therapist is like a detective. You have to try to look at all the angles possible. You have to try to understand where the person is coming from. And this requires very, very beautiful, compassionate ears. Compassionate ears that listen, not just hear, but listen. Remember, hearing is different, listening is different. Many people hear, but few listen. The capacity to be a good listener is a very important capacity, because it is so amazing that so often when people talk about the problems to you, as they talk about them, they will give you their own solution. You don't have to find the solution. But because they never talked about it, they never had an opportunity for the solution to come into their consciousness. And often, I find people, when they're talking about the challenges to me, they say, oh yeah, I just found the answer. Now the problem is, then they think that all they have to do is come and tell me the problems and they'll find the answer. And there are a lot of people who think that. Sir, if we tell you our problems, we find the answer, sir. It gets solved. And it's not because you tell me. I'm giving you the space by listening, and you are finding your own answer. So important, I tell you, to be a good listener. You have to care about other people, okay? You have to like human beings. Sometimes they really test you, but you have to like human beings. You have to be able to really like people and love to hear people's stories. Because over the years, the last 2.5, 3 decades of listening to people's stories very consciously, what I realized is that we all share very similar problems. They're just worded differently, but the problems are so similar. It's just astonishing. It doesn't matter what nationality, it doesn't matter what religion, it doesn't matter what you eat. The problems are actually very, very similar. It's quite amazing. And it really tells you a lot about the human being. And it's not surprising because, you know, a human genome, about 98% of our genes are the same. All this variety is just in about 2% of our genome. So no wonder, no wonder it is very, very similar. It may be in different languages, it may have different expressions. So heya, hetu. Then comes the next part. Once you have found what is the challenge, what may be the causes, then comes the next part is, where do you want them to go? Where do they want to go? Or let's put it this way. Where do you and they want to be? Let's forget going. Let's think about being. I like that concept of being, because that is what we should be. It's not about going to a new place. Where do you want them to be? Where do they want to be? That Sukhasthanam, again, because being is Sukham. That is the Hana. Now, interestingly, they may have a totally different perspective than what you think they should be. And you should have the humility to accept their perspective too. Can you again have space for their perspective, not just yours? One of the ways I deal with this personally is often in one of the first visits, I ask the person, what do you expect from yoga? This is a question I actively ask people when they come to yoga as a therapy. What do you expect from yoga? And what they say will often be very, very different than what I would think has brought them to yoga. And I always tell a story of a lady who came to me many years ago. She was one of my first clients, patients. And her son was a doctor, husband was a school principal. And I asked her, what do you actually want from yoga? What brings you to yoga? Now, of course, one was, someone told them, go to Dr. Ananda, he'll solve your problem. As if I'm a magician. I like to tell people I'm a musician, not a magician. But people get that confused. The magic happens within you. But music can make magic happen. Okay, that's a different perspective also. I said, what do you want? What is it that you're looking for from yoga? She said, doctor, I'm very depressed. I have all these body issues. But she said, what I really, 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 really want is to be able to sit down in my puja room at home and pray to my God. Because she said, because of all of this, I cannot sit down in my puja room and do my daily puja. My rituals at home, I'm not able to do. This is all that I really want. She said, I don't care about my arthritis. I don't care about my insomnia. I don't care about my depression. What I really want to do is this. Couple of months later, she comes to me and tears of joy. She says, I can sit down comfortably. She said, I can do my full puja. I can have the satisfaction of worshipping the divinity. And she says, I feel so much better. I don't have any problem. I tell you, as a medical doctor, I was thinking, okay, we have to get our endorphins up and we have to work on dopamine and we have to set right the knee joint. And, you think of all this other stuff, and all she wanted to do was to comfortably be able to do her worship, daily worship. And she told me, she said, doctor, I have a new definition for yoga. I said, what is it? She said, yoga is the best antidepressant. She said, yoga is the best antidepressant. And I'll not forget her. Because of her, at least 30, 40 people have come to me over the years. She tells them, go to Dr. Ananda and he'll set things right. They set it right. You only facilitated. You helped them find the answers. Another gentleman at Saita, and a Muslim gentleman. Now, in India, we are still stuck with, is yoga Hindu? And many countries, they still have these issues, and will other people accept it? There's a whole bandwagon that runs on that gas. As Swamiji says, yoga makes you better whatever you are. That's all, full stop. It makes you better whatever you are. There's nothing else with it. This man had a thymoma, a type of cancer, and they had removed one full lung. Now, out of 2 lungs, one whole lung was removed. And his cancer specialist told me, I'm sending this guy to you. We have removed his lung. Teach him some breathing exercises. That's what they think we do. Okay, teach them breathing. They don't know our conspiracy and behind the scenes work. They think we are just teaching relaxation and breathing exercises. Let it be so. Invade from within. I said, okay. So this man came to me, again as usual, after our evaluation and discussion, I said, what do you expect from yoga? He said, you know, doctor, I've had this cancer, they removed my lung, I'm on chemotherapy. But that doesn't bother me. What I want is to be able to pray to my God by doing my namas. They have the ritual namas, which is a series of physical movements very similar to yoga practices. And in fact, Fida Hasnin, one of my father's friends from Kashmir, a Sufi, he had written a book where he said, Namaz, the Yoga of Islam. An old book he wrote, which was Namaz, the Yoga of Islam. He also wrote a book on Jesus in Kashmir. Long back, this is in the early 1980s. There's a newer version which is quite plagiarized on his work. It's come out recently on the same topic. So we said, okay, fine. We started working with this Muslim gentleman and doing the different practices. And after a few weeks of regular, he used to come 3-4 times, I remember, to Saita. We met him. He was so happy. I still have a photo someone took of him. He just caught hold of my hands and he said, Doctor, I'm so happy. I'm perfectly at peace with myself. I can worship my God. I can do my namas. And I am ready to face death any day it comes. He said, I'm ready to face death. I'm not afraid of it. I'm so happy. It was amazing. I had tears running down my eyes as he talked to me, and Meena was there, a few others in Saita were there with us. Later on, I was talking about this to our trainees at the hospital who are doing our postgraduate diploma. And I was talking about how yoga had given him what he wanted and let him come into a space which is the most healthy place to be. Not about the cancer being cured, but being in a place where you are healthy. And out of the corner of my eye, I saw this cancer specialist walk by. So I said to my students, give me a moment, I'll go and meet him and come back. Ran out the room and I said, hello, sir, how are you? And I said, I'm so happy that this patient of yours, so-and-so, who had his lung removed, he's really doing so well. And with the yoga, he's in such a beautiful state of mind. It's just amazing, sir. And you know, that cancer specialist turned to me and he said, that is his problem. He said, you know, he's too positive and optimistic about life. And I'm like, seriously? He said, yeah, you know, he's going to die and, you know, there's so much of pain and so much of agony. And, you know, he's denying all of that. And I'm like, seriously, your headspace is in the wrong place. Huh? I came back into that room and I just collapsed because I was like, imagine all you can think about is someone who's going to die should be in pain, they should be suffering, and they should be calling out. And you know, you don't want, you're not happy if somebody is at ease with themselves. What a corrupt medical system we have created, where an individual sense of ease is not recognized or valued. I have seen this so much. I tell you, and this is why when we talk about the Hana, the goal, that goal setting, we have to be very careful because we may think, oh, I'm going to cure this person and set right the lumbar, you know, vertebrae, and I'm going to get the discs back in and I'm going to bring the sugar levels down. You know, you'll have all this gung-ho target setting. And all the person wants to do is sleep better. They just want to be able to sleep at night. They just want less pain. Our yoga therapy center, well, now we are running all over the building because of COVID. Our building is taken over for COVID patients and treatment and vaccines and all that other nonsense that they're doing. So what happens is that we are running around the whole campus. Every few months we have a new office, so we never know where we are. But in our original office space, we were on the same floor as palliative care. And I think that is a beautiful place for yoga therapy to be. Because palliative care, nobody wants to be there. Nobody wants to see suffering. Nobody wants to deal with end stage. Everybody wants to, sort of hide away from that. And just for our students to be there with the people who are there. I remember so many times after somebody would die, the next day as all the bills were being settled and people were getting out, the family would come and talk to us and thank us, saying, thank you that your students came there and they were with my father or my grandfather or my grandmother. It meant a lot that there was somebody they could talk to, somebody who would, engage them and give them something to look forward to. And, the breathing you did or the listening or the simple body movements are so much appreciated. Now, normally in India in hospitals, nobody thanks you when they go. They just want to run out of the hospital and never see you again. Okay. So if somebody stops and talks to you, it means you have really touched people's heart. And I think this is so important to go into places where other people don't want to go. One of the key elements we have worked on is yoga therapy for special children, children with special needs. People who are having gender issues, the LGBT, the transgender community. Again, the senior citizens who often, people hide them so that you don't see them anymore, giving them a beautiful approach to life, going out to people who would not get the benefits of this if they had to pay for it and give it to them free. It's so important that this type of approach is taken. And we have been really blessed in a few things in this way, because as a yoga therapy unit in a medical institution, we have had that opportunity to go places nobody can normally go. And our students, our yoga instructors, they go into the psychiatric ward 4 times a week. They can work with the patients and the patients enjoy it so much. I remember the first batch of patients who came to Saita, they had to be sent by the doctor. The next time they came, they had another huge batch with them. And we said, what happened? And the guy said, that guy felt so much better. I want to feel like him, so I have come today. People would come. But then the department got a bit scared. They said, what if these people abscond? Because, they had to go from one building, which is psychiatry department, to the yoga therapy in another building. And if, one of your patients absconds, who will be responsible? So then we said, okay, we'll send our yoga instructors to the ward and they go there. And they enjoy it so much. People feel so much better. So what I'm trying to say is the goal setting Hana component of yoga therapy is not just what you think that person should be or where they should go in goal setting, but where they want to be. What is their expectation? Keep the space for their expectation, and then you will have a wholesome experience. And the fourth component. So first one, what are the challenges? Second, what is the root cause? Third is, where do you want to be? And fourth, how do you get there? What are the tools you use? Are you going to use asanas? Are you going to use some pranayama? Are you going to do relaxation? Are you going to try to give them the philosophy and psychology of yoga to help them deal with their issues? Often when you talk about some of the philosophical and psychological concepts to people, which is yogic counseling, that is what we call yogic counseling, where you bring these concepts to the mind, let them know that these concepts exist. And suddenly these concepts come alive for them. They say, wow, I can try this. Pratipaksha Bhavanam is the most important one. And adopting the contrary attitude, the basis of modern CBT. Here, understanding the bigger picture. When you have a negativity surface, be mindful of it and tell that negativity, I don't want you, please get out. Bring a beautiful counterpoint. I like to tell the kids, I often tell this to Divya as a life lesson. When people are being very good to you, remember all the bad things they have done. And when people are being very bad to you, remember all the good things they have done. I think it's very, very important to keep this balance in your mind, because what happens is sometimes, when people are being good to us, we go to one end of the spectrum and we are off balance. And when people are being bad to us, we go the other end of the spectrum and we go off balance. So when you can keep the opposites in mind, you will always have that balance. And I think it's a very beautiful way to say that how fortunate we are. How fortunate we are to have these opportunities. And the moment you realize how fortunate you are to have an opportunity, the negativities go down. This is where you become a giant instead of being an ant. Because as long as your consciousness is an ant consciousness, every wave in life will be a tsunami. As usual, the God of the internet conspires and Ananda, why are you sharing all these secrets with these people? Huh? And so cut the internet. Seriously. It just happens when I'm giving you all these beautiful messages, right? It should happen when I'm talking to you all about how great I am and how beautiful, how handsome I am and how you all must love me and fall at my feet. That's when the internet should cut. It doesn't cut at that time. When I'm trying to tell you something bigger, the internet is God of internet. Seriously. Huh? Okay, fine. Anyway, let's get back to it. When you are an ant in consciousness, every wave will be a tsunami. And when you become a giant in consciousness, even a tsunami of challenges will be just a wave for you to navigate. It is a change in consciousness. You are outgrowing your problem. That is what Swamiji would say. He says, you are going to outgrow your problem. When we talk about this, there's always the question, can I do it? Can I do it? And the answer is yes, you can do it. Because what happens is we have a tendency as a voyeuristic human being. We are basically voyeuristic by nature. That is why you have thousands of 24-hour TV channels about everybody else. But if there was a CCTV just on you, you would never watch it. We always want to know what's happening to others, what others are doing, what the neighbors are doing, and all that. We don't want to know what's happening within ourselves. You see, what happens is the moment the negativity surfaces, you have to recognize it. Patanjali tells us the moment the vitarka, he uses the term vitarka, Vitarka, vitarka. Vitarka, which means a deviant. The moment the deviant surfaces in your consciousness, catch it. Just as you catch a weed right when it is a small thing that you can pluck out. But what we do is, instead of plucking it out when it is still a small weed, We watch it grow, and by watching it grow with the power of the mind, we make it a huge tree, and then it's a giant oak that is so big. The redwood trees of California, instead of being a weed. Because what we have done is we keep on embellishing it. What next? What next? What next? And that is why Patanjali's advice in Pratipaksha Bhavanam is, the moment the Vitarka surfaces, catch hold of it and replace it with the contrary perspective. Now we often say, oh, think when you hate somebody, think something lovable. It may not be possible to love some of these people because they may be really such a pain in the wrong place. But the least you can do is to think about all the good people in your life. Even if you cannot feel love for that person, feel love for all the people in your life. And the moment that love comes in, the hate has to subside, because raga and dvesha, like and dislike, are the polar opposites. And the moment you start to bring something else, this is why I like to call it the dilution therapy. And we have talked about this in one of the earlier sessions, where you look at the bigger picture and your problem starts to become smaller because the picture becomes big. You have taken an expansive perspective and bird's eye view rather than going down with your nose touching it. And when your nose touches that problem, you'll see nothing but the problem. You take your nose out of the problem. We have put our noses in our problems, and that is why they seem unsurmountable and so big. And what we need to do is get our nose out of it. Our big, long nose. Yes, Sangeeta, you know, Italian long nose. Yes, Pinocchio. Yeah. Huh? This is why, you know, Sangeeta said that, you know, I never judge her, but I may mock her. The other day when she gave her testimony about me, she said, I may not judge her, but I may mock her. Yeah, she's listening to me, see? Huh? You don't know how she mocks me, okay? So this is nothing compared to what I get from her. We put our long nose into the problem and then we say, oh, I cannot see the solution, because your nose is deep, very deep into it. Get your nose out of it. What is your nose? Your ego. Some of you may have seen that image I give of the rhinoceros making paintings, and every painting by that rhinoceros has a huge horn in it, and the rhino horn in every picture that it paints. And I ask people, what is your horn in your picture? And it is your ego. Because it is our ego that then comes into the middle of the picture and corrupts the whole picture. And that is why my father said, you don't have problems, you are the problem. Because your identification with the problem is where the whole issue comes. And getting your nose out of it is taking an objective perspective. Now, this is something that I could talk 5 hours about, because we human beings are so complex. We human beings are so complex that even the aliens don't want to visit us. They are staying planets away because we are so complex. They say, just, you know, we say, you know, stay away from them by, you know, a 6-foot pole. They say by, you know, 6 planets away from Earth. That's the alien measure for us, because we are so complex, so complicated. And ultimately, the whole thing is because of our identification. And why do we identify with it? Because we don't know better. Again, the philosophy of yoga gives the basis of yoga therapy, that we need to stop identifying with the problem. Instead of saying my problem, start looking at it as the problem or a problem, not my. Instead of my diabetes, the diabetes. Instead of my cancer, the cancer. You have created a gap between you and the disease, and in that gap, the solution will manifest. If there's no gap, the solution has no space to manifest. We have to create a space for the solution to manifest. And that is why, as long as we identify with our problem, as long as we identify with a disease diagnosis, it is not going to be possible to come out of it. And this is where one of the first principles of yoga as a therapy is self-responsibility. Self-responsibility, not self-blame. Many people think self-responsibility means self-blame. No, this is self-responsibility, which means you look at what needs to be done, get empowered to do it, and do it. Not depending on somebody else to do it for you. And that is why yoga as a therapy has to enable the person to start to manifest these changes. The ability to say, my focus will be on health and not disease. The whole focus of modern medical management is disease-based, pathogenic. Always we are looking at disease, and that is why when we talk about yoga for diabetes, yoga for cancer, yoga for depression, yoga for, again we are focusing on disease. And that is why it should be yoga for yoga's sake. Yoga for yoga's sake, and everything else will happen on its own. You don't have to do yoga for diabetes. You do yoga for yoga's sake, your diabetes will get managed better. You do yoga for yoga's sake, your depression will get managed better. And that is why now I've started turning that phrase around, and instead of saying yoga for diabetes, I say managing diabetes through yoga. Managing cancer through yoga. And that is why when I wrote my book on yoga and stress, I didn't say yoga for stress. I said a yogic approach to stress. You need to approach stress. We are running away from stress. You need to approach it with a yogic perspective. You need to approach the disease with a yogic perspective. And that is why it is so important to start focusing on what is called swasth, which is the state of health. And that is why over the last 5-6 years, ever since my professor of medicine and former vice chancellor Seduraman sir introduced it to me, salitogenesis has been my keyword. Focus on health. We want to enhance health. That is again Pratipaksha Bhavanam. Change your focus from pathogenesis to salitogenesis. It is also a Pratipaksha Bhavanam approach here. Instead of focusing on the lack of health, start to focus on the factors that will help you to be healthy. Instead of saying, oh, the environment is bad, try to create an environment where you can be healthy. Instead of saying, oh, my food is bad, say, what are the food items I can eat to make me healthy? You start focusing on manifesting health and abundance, not the lack, because the more you focus on the lack, the more the lack is getting empowered. Because what you focus on gets empowered. They talk about, are you feeding the good wolf or the bad wolf? It's the same thing here. Are you feeding disease or are you feeding health? And recently, my dear Rama Reddy sir, who is one of the most eminent psychiatrists of India, and his greatness is he's doing his PhD in yoga therapy with me as a guide. I am 2 decades younger than him, and such love and respect from him that, sir, I'm humbled. And he gave a recent talk, an amazing talk, in which he brought this concept of salitogenesis and took it to even so many more people who are working in mental health in India. And sir, what you are doing for the sake of yoga is wonderful, sir, because your words carry such weight in that whole community. Dr. Ananda saying it is fine for the yoga community. But when Dr. Rama Reddy sir says it, the whole community of psychiatrists in India, they sit up and take notice that we need to focus on health, salitogenesis. Salitogenesis is the key. And that is why what is important is that we see sometimes there are issues that can be removed. And this is where we have the concept of psychic, psychosomatic, somatic, and organic stages in disease. In the psychic stage, it is, and I've discussed this, I think, when we talked about the koshas in one of the earlier sessions. In the psychic stage, it is something that can be still dealt with because it is still not settled into the body. In the psychosomatic stage, it is like a temporary alteration of the physiological process by the psychological changes. So it is still temporary. So a psychic and psychosomatic stage of the disease can be managed, and you can actually maybe even get what could be possibly called a cure. Then comes the somatic stage. Now, somatic means what has happened is the disease has been around so long that now it has become permanent in your body. Now you will need yoga to be an adjuvant therapy. And we, the other day, published a new paper. It took 2 years to get it published, a lot of work, but well worth it, on yoga therapy and diabetes and how it can be renoprotective, protecting the kidney in diabetic. This was a good study by Dr. Balaji as part of his MPhil. And I've shared it with some of you. If you haven't yet seen it, let me know and we'll share it. A beautiful one where 4 months of yoga, the changes, positive changes in kidney function, along with the glycemic control. And another paper was the lung function. It's all the same work, split into 2 papers. Once the condition becomes into the body, it's become permanently in the body. So yoga becomes adjuvant. It is an add-on therapy as part of a holistic management that may involve modern medicine and other systems. Then comes the 4th stage, which is the end stage, which is organic. And it means that the target organ damage has occurred. So in hypertension and diabetes, we would say the kidneys have got impaired, or the eyes have get impaired, or, a person has gone into, retinopathy or something from it. Target organ damage is where the organic phase comes. And here yoga therapy is an add-on, an adjuvant, and what we call secondary and tertiary prevention. Dilip Sarkar, my dear Dada, mentioned this. See, primary prevention is where you prevent it before it occurs. So start young people on yoga, you may prevent them from getting certain diseases. That is primary prevention. Secondary prevention is the person has diabetes and you are preventing them from worsening the condition and going into, any organic stages. So you are keeping them in the somatic and trying to bring them to the psychosomatic stage. It is secondary prevention. Tertiary prevention is now the condition is deeply ingrained and you are trying to minimize the damage of the target organs, which is what our recent study showed, that it is renoprotective. That is, the impairment of renal function may be prevented in people who have long-term diabetes. So psychic, psychosomatic, somatic, and organic. So to answer a question that came up from Sunny, in psychic and psychosomatic, definitely I would say a good yoga therapy will help the person to get back to as normal as possible because it is still not settled permanently into the body. But the problem is, most of the time people don't come to yoga therapy at that time. Usually psychic, psychosomatic, they don't come. They come when it is organic. And often I have people come to me, doctor, next week I have a kidney transplant. Can you teach me yoga so that I don't have to have a kidney transplant? That is the problem. People come at that stage and it becomes very difficult. I wish people could come when it is in psychic and psychosomatic. You would have amazing changes brought about. See, somatic is that it has come into the body. Organic means now it has been long enough in the body that it has remodeled your organs. So I like to give people an example. I say, you have an unwelcome visitor visit you. They come for a day and go away. That is psychic. That person comes and stays a week in your house. Now it becomes psychosomatic. But still at the end of the week, they are going to go away. Now that person decides they are going to live in your house from now on. The camel story. Now it has become somatic. They are in your house permanently. And organic is when they start to decide that instead of the kitchen, they want a toilet there, and they start to remodel your house to suit them. That is when it becomes organic. And I hope this metaphor will help you understand what happens. The unwelcome visitor just coming and going is psychic. Coming and staying for some time, psychosomatic. Taking on permanent residence is somatic. And starting to change your house for their whims and fancies, organic. Kalavati has a question. The same with pregnancy yoga. Absolutely. Absolutely. You know, if I tell people, you know, where do you start pregnancy yoga? You start when you have the young girls. When the girls are young, before puberty, that's where you start pregnancy yoga. And that is primary prevention type of stuff. I'm not saying prevent the pregnancy. What I'm saying is primary prevention in the sense of health-wise. Get to them when they are young kids. Give them the yoga. As they come through their menarche, as they come through all the changes, and then they get married, keep the yoga going. And then they become pregnant consciously with the yoga. And then at that time, you continue the practice. That is where it is true pregnancy yoga. But people come in at 35 weeks, that is typical of what happens here. And all you can do is maybe a little bit of pranayama and not too much at that stage, but still it helps people. I'm not against it, but I just wish they would come earlier. With regard to illnesses like schizophrenia, are they at psychic level? No. Schizophrenia is not just at the psychic level, because it has now become a permanent for that individual. So it has actually, though it is, see, we are thinking that it's in the mind, so it is psychic. It doesn't mean that. When it is long enough, it is actually coming into somatic level. And then you are going to start to have body symptomology because of it also. It is not just a, people often think like depression. People think of depression as only a mental issue. There is a lot of physical symptoms associated with mental health that people don't think about. And this is why we have to be very careful. It doesn't just mean it is at the mind level. It means that it can be somatic also, and schizophrenia can become organic also. So it is not that mental disorders are always psychic and psychosomatic. They can also be somatic and organic, but definitely yoga is going to play a role. And Rama Reddy sir's PhD topic now is on the some of the symptoms in schizophrenia actually. So we are looking forward, because he is the most capable, competent person for that research, and it's going to be amazing to see what comes out of that. Fine. We have really come to the end today, but I'm going to take a few questions. If anybody wants to have unmute, you just put up your hand or something so that I can unmute you. If you want to say something or ask something, we'll take a few questions, because I have in half an hour, Divya has to do her stuff. Yes, did I see a hand go up someplace there? I'm just looking at them. Any mental hands going up? Kalavati, you wanted to say something? You are spotlighted, so you better say something.
Is that because no one's put their hand up? Yeah, I guess in some ways, just if you're teaching yoga well, by default, you're kind of helping people sort of heal themselves and better themselves, and slowly sort things out anyway. Because one of the things I do believe with yoga is that if the yoga's good, and that's what I really do strongly believe in this tradition of yoga, that it's a really grounded approach and it helps regardless. And I feel that with people generally practicing anyway, we're constantly twisting and turning, releasing, throwing out, and in whatever practices that we're doing, that it's a very kind of gentle way to helping people get rid of some of the stuff that they're carrying that obviously can lead to more sort of severe or diseases, sort of later on. So the fact that we're constantly, doing these practices that do kind of lighten our load, even if we're not specifically coming at these, yoga classes or these yoga practices from a sort of yoga therapy angle, we are by default largely working in that way anyway.
I very much understand your perspective, Kalavati, and it's a beautiful perspective, because what we are focusing on is the health enhancement, or what we would call a promotion of positive health. So I think the angle there is a promotion of positive health and enhancing a sense of health in people. And when we start to address specific issues, then sort of it becomes more therapy. So I think here it's sort of the window through which you look at the issue determines it becoming yoga therapy. This is something that often comes up, is that the perspective, it's like the window. When you are looking at general health enhancement, and yes, it does, and symptom mitigation and other things, this is going to happen. But if the perspective is just promotion of positive health, it comes more under a general yoga banner. And when you start to say, okay, this person has a certain issue, we are going to try to address it in a specific manner, it starts to become yoga therapy. I think it is sort of like the focus. Where have we chosen to focus? But ultimately, there's a lot of similarity. And many years ago, I got a bit upset with a dear friend of mine who wrote a book where he said, if people come to you for yoga therapy, don't teach them yoga. And I know where he's coming from. I know what he means, but that phrase didn't sink in well with me, because it's like saying that yoga is different than yoga therapy. And we have to understand yoga is the big circle, yoga therapy is a small circle within the big circle in a Venn diagram, which is what we try to put out in a nice article jointly put together by 4 of us. And I'll share that later with you. It's a nice one, Shared Language, Foundations of Yoga Therapy. I just wanted to see, I saw a question here from Asha. Mostly we recognize a disease when it comes physically and the symptoms. How do we catch it at the psychic stage? See, in the psychic stage, what is going to happen is there will be more of a sense of not feeling yourself. That the psychic stage is not specific to diabetes or hypertension. It is just where you do not feel like yourself anymore. You don't know what is the matter, but you are having a sense of dis-ease. You are not at ease with yourself. So it's not yet consolidated into a specific disease at that point. So there is not really a symptom of, say, diabetes or a symptom of any disease. When it becomes psychosomatic, it starts to now come into a certain system. It may be the cardiovascular system, it may be the respiratory system, depending on that individual's genetic predisposition, environmental factors, and lifestyle. So the psychic is still going to be quite common. And most people say, I just had a day off, so they're not worried about it. But now if you keep on having a day off every day, then it starts to affect you and your physiology gets affected. And then depending on the tendencies, which is again the samskara vasana patterns, that are then our genetic and environmental factors. So Asha, to answer your question, here you're not really looking for symptoms of a disease in the psychic stage. You are just looking for the fact that the person is not at ease with themselves. And this is where the split at the Anandamaya Kosha has come into sort of the Vijnanamaya, Manomaya, is not yet come down into the Pranamaya, Annamaya so much. So if we again use the Panchakosha model, it becomes easier to understand this. Psychosomatic is where now the Manomaya and Pranamaya are involved. Somatic is the Annamaya. And when you come into organic, it is very deep into the Annamaya. That is why it becomes very tough to dislodge it when it comes into organic stage. So just to give you that again, Sunny, did you want to ask a question or did I get your question already? I'm trying to find you. 1 second. I'll just ask you to unmute. Yes, Sunny, please go ahead.
Namaste, sir. Thank you so much. I just want to say, I got great relief from Sukha Purvaka and Sukha Pranayama, and I got a hope that yes, I can be cured completely. So is it me being very optimistic about it, or like is it like so just want to understand, like if I am feeling better with these pranayama, so is it okay for me to feel optimistic about the complete recovery?
Absolutely, Sunny. Thank you for sharing that, because see, the very fact you are feeling better, the very fact that you feel optimistic about it means that you are on the path to recovery. Okay?
Thanks.
So the main thing here is to keep at it. It is like, what my father used to say, when something is working, keep it going. And I think it is so important, because when something is working, we have a tendency to start experimenting. We start to say, okay, maybe if I don't do it, what will happen? This is where we have to remember to keep on the path. And again, every time you do it, what is going to happen every time you do it is that you are going to enhance your own capacity to heal yourself. So keep working on it. The most important message here is keep working on it. Keep working on it, and you will find tremendous improvement. And if you're taking medication, do not stop it without your doctor's advice. I think one of the most important things we have to always remember, and even though I'm a medical doctor, I tell people who come to me, go back to the doctor who prescribed your medicine. Let them see the changes in you. Let them reduce the dosage. Let them stop the medication, because they know where you were when they gave the medicine. I don't know. And that is why it is always ethical. And the second thing is that doctor will come to know the benefit of this person doing yoga also. So it is again giving education to our own fellow medical professionals. I have a question from Ingan here. Your approach makes a sense. Are there cases you've had challenges? Absolutely, lot of challenges. Lot of challenges. And I've had my share of people who I've had to say, maybe I am not the right person to help you. You may need somebody else. And I think this has been part of my own lesson in humility, to know that I am not the one who can always help people, and that sometimes people need somebody else. They may need another yoga approach. They may need, a more advanced medical approach. Often I've had people, I've said, you have to get to the psychiatrist and get yourself evaluated. I am not the right person for it. Our approach is not working. Or the diabetologist. I had a person who was not improving, and I said, you need to get a diabetologist involved. Otherwise, we are not going anyplace. So yes, it is not that it's always successful. We tend to talk about the successes more than failures, but it's not a failure in any way. It is a learning experience. And for me, every time I have what people would call a tough case, what I feel is that I learned something out of it that helps me deal in the future with other people in maybe a different way. So as long as we learn from it, I think it is fine. And it's what life is. It's what life is. There's it is not always going to be an upswing. So yes, there are. Yes, I think Meena wanted to say something about that, because we have our share in cider of stuff like that. Yes, please.
Namaste all. Now, this is again one more success story that I just wanted to say, because the importance of yoga therapy, which was first established at Saiter, was with the case from dermatology. The patient from dermatology who was suffering from, with psoriasis. complete psoriasis, and she had been treated with all the medicines under the earth, under the sky for the past 3 years, and she was labeled as a non-respondent, but still she was nagging the doctors, what do I do, what do I do, what do I do, what next, what next, what next. So we stay right next to the dermatology department. So the doctor said, okay, I don't know really what to do, so go to yoga therapy. And they just referred her to yoga therapy. This lady came to yoga therapy, and the moment she started doing, she said, like, there's something good about it. But then after 1 week, they found that she was responding to methotrexate. Methotrexate is often the drug that is given to psoriasis. So after 1 week of yoga therapy, she was responding. A person who was labeled non-respondent for 3 years, not responding to any medications, and now began to respond, and slowly, the stage of reversal started, and she became almost normal. For a person who had been admitted to the ward for a long time, now she got discharged and she went home, and she is now practicing, of course. And that was after that the dermatologist started believing, okay, there is something in yoga, and they started referring. So the main thing is here, what we understood was that anybody, the participant or the patient, what happens is that they are focusing on the problem. So when they are being medicated, when taking medications, just like what Sunny said, when you start doing yoga therapy, your focus is now channelized into something else. It is kind of like you start channelizing your focus on getting better or feeling good. And my problem, what is happening to me, the skin is not responding, why, because instead of keeping nagging, you're just poking and nagging on the problem, you just come out of that, and then you start thinking about the solution, which is kind of like getting you better. And like you are in the path to wellness now, you start walking in a different direction entirely, and that brings the change. The tool, the therapy, everything is you, your own self. And that is very, very important. Like sir often keeps telling, the therapist has to be the therapy themselves. It is not the therapist, they are just the tool. More often, like we have had experiences where just with talking, an hour of just talking, and then they are fine, they are good, they don't even have one session of yoga. Like with a psychiatric patient, like a severe depression, after 1.5 hours of talking, just talking, plain talking across the table, and more often than not listening only, the end of the session, she just walked out, she threw something into the trash bin. And I was wondering what it is. I asked her. She said it is a vial of something which she wanted to take after going back to the ward, because she was completely fed up with life, and she wanted to take that poison, and she wanted to end her life. So that is like the goosebump sessions like those we have had, because like just with talking, venting out, wording out the problems, they find their own solutions in that. And again, instead of focusing, when you have a problem and you're just keeping it close to your eye, you can see nothing else, the whole thing is blinded now. And now when you just keep it out, at a particular distance, you are not subjective of it anymore, you become objective, and you start analyzing your own problem when you're wording it to somebody else. And you find your own solutions. So the problem, you just keep it at a distance, that's it. And like there are so many things like this. But the main thing is like your focus is being deviated from the problem into a solution, which you yourself find, maybe with a technique in yoga, or maybe by talking out, or maybe with pranayama. That is your that is your homework. Where you find the solution is your homework, but you definitely find the solution with practice. Thank you, sir.
Thank you so much for sharing. That's very beautiful. And this is why we currently, one of our students is doing his PhD on the effect of yoga in psoriasis. And when we Googled and we started doing literature search, we found there's not much work on yoga therapy in skin disorders. And there is an entire spectrum called neurodermatology, psychoneurodermatology, is how the mind affects the nervous system and affects the skin. And the yoga would have a great role to play there. And already we have been finding some amazing changes, even with our pilot studies, where it's just astonishing, the different scales that come down. So definitely lot of scope is there. And what we need to do is just keep working on ourselves, helping others. So just to bring it to a summary, Yoga Chikitsa, well, the whole process is to help us regain a wholesome state of oneness. What is keeping us away from that oneness? What are the causes of that? What are the tools to get back to the oneness? That is what we need to work on. And in the process, we need to have compassionate listening. We have to have a compassionate, empathetic heart. And we have to have a discerning, objective head. Because if that is there, this combination is an amazing combination. Discerning intellect, empathetic heart, and ears that listen, hands that heal. My father used to always say that when you use your hands to help people, it should be Ayam me hasto Bhagavan. Ayam me hasto Bhagavan, which means my hands are the hands of the divine. Ayam me hasto Bhagavan is the mantra. Just see if I can type it out for you. 1 second. Yes. So that you have it. Ayam me hasto Bhagavan. Hasta is the hand, Bhagavan is the divine. Our hands are the hands of the divine to help others heal. And when we realize that, our hands are an extension of the heart. So the caring heart through the hands can help others. And then it truly becomes Yoga Chikitsa. So we'll stop there for today. And I didn't want to go into nitty-gritty. The Satsangha is not about nitty-gritty. That's a lecture series. That is a special course on yoga therapy that will come in due course. But for now, it is the principle that lies behind it, which I wanted to address today. You have all been a wonderful fellow Satsangis today, a collection of people coming together, seeking the higher reality. Thank you for being you, enabling me to be myself. Let us all grow and glow together in yoga. Om Loka Samasta Sukhino Bhavantu Sarve Janah Sukhino Bhavantu. Om Shantihi Shantihi Shantihi. Om. Okay, thank you. That's it for now. See you later, whenever is later. And in another 10 minutes, we'll be back with Divya's session for Ammaji's healing, focusing on the Guru today. Don't miss it. See you all soon.